Now, the U.S. Embassy in Nairobi has denied claims that a new $206 billion health agreement with Kenya involves sharing Kenyans' medical personal data. The 5-year deal, aimed at strengthening Kenya's health system and building self-reliance, has sparked privacy concerns. But American officials say the framework strictly protects patients' information. Frida Okachi has the details.
Amid growing concerns over data privacy, U.S. officials are moving to make one thing clear. Personal health information is not on the table in this new deal with Kenya. The clarification comes as the two countries formalize a 5-year health cooperation framework worth 206.6 billion shillings, a deal designed to help Kenya build a more independent and resilient health system. But questions about what data might be shared and how have put American diplomats on the defensive.
The government is able to use that data to really work transparently to identify how to ensure that services are available, that they can place their resources where they need to be. But it's not about the U.S. government coming in and looking at people's information.
According to officials, the framework strictly adheres to Kenya's privacy laws. Any health data shared will be anonymized and high level, used only to improve resource planning and not to track individuals. Specimen testing, they add, will only happen with Kenya's explicit consent and only when the country's own lab capacity falls short.
The relationship that we've had with the government of Kenya is for when they are not able to test something because their lab system isn't to that level, we're able to take it within our labs and to be able to do that testing to get really specified information that we can then transparently share with the government. And it's not about, again, us finding out information about individuals.
So what exactly does this agreement include?
How we are able to manage the systems that Kenya needs in order to manage its own health system as efficiently and as effectively as possible.
The partnership builds on decades of U.S. support through programs like PEPFAR and the President's Malaria Initiative, programs credited with saving millions of lives across Africa. But this time, the emphasis is on transition, preparing Kenya to take full ownership of its health programs.
The investment that we're making is in things like commodities, purchasing commodities, the salaries for healthcare workers, as well as helping Kenya build a digital system, a system of managing medical records and things, so that Kenya is able to manage an effective health system at the end of the 5 years.